Approaching a workers' compensation case is very different than a motor vehicle accident. Number one, there's no pain and suffering and loss of enjoyment of life. So you have to maximize the lost wages and the medical benefits. The first thing we do is make sure that you've got a doctor that's an expert in your type of injury. I represent field workers. We need to get a pulmonologist to help their lungs with chemical exposures. I represent carpenters who fall off scaffoldings that need the best orthopedists. We know the people that are the best hand doctors, the best spine surgeons, the best extremity surgeons. Get the client to the right doctor. This is where the workers' comp carrier is against you. The insurance adjuster has their favorite doctor. That doctor is going to try to return you to work many times when they haven't even done a diagnostic test like an X-ray or an MRI to find out exactly what's gone to you. They're called the primary care physicians. They're usually CentraCares here in Orlando. They're geared to see my sons when they have earaches. They're not orthopedic surgeons. We get you to a specialist, which is where you need to get. After you do that, we then look at your lost wages. You're entitled to a comp check at 2/3 your average weekly wage. That means if you make $300 on the job, your check's $200. You get that three ways. One, the doctor says stay home. I just did surgery, stay home 2 months. The second way is you're light duty. The doctor tells the client, look, no lifting over 5 pounds. He goes back to the job site. The construction job superintendent says, your tool belt weighs 20 pounds. I don't have a job for you. So I can get you a check if the job site doesn't have a job for you. The third way that you can get benefits is if they fire you. Many times the masons specifically have to finish the wall within a certain time. So the ambulance takes you away, you're fired, and they've hired somebody else. If you don't have the right doctor, you're not going to get the check. And the insurance industry is going to try to keep you with the primary care physician at CentraCare to deny you benefits, and that's when my law firm moves in and fixes the problem.